When was the last time your child had his or her eyes checked? If your pediatrician was the last one to do the exam, you may want to make an appointment with an eye doctor. Dr. Mandy Steele of Eye Care Associates is here to explain why a comprehensive eye exam really is a better idea, isn't it?
I think so, yes. I think your children are usually very well taken care of at their pediatrician. And they tend to check their acuity, which is what we know of 20/20 vision. But some things are often missed if that's all they see on a yearly basis. They need to have more of their eye system checked, their vision system, to make sure that everything is functioning properly, not just their faraway vision.
Okay, so let's begin with the actual differences. I mean, I think I recall last time my sons were checked at the pediatricians, they just sort of stand however many feet away and point and name what the letters are.
Absolutely. So that's an acuity chart, and they're looking to see if each of their eyes is functioning at a normal level for their age. And that's a very important first step, because you can have children that have what we call a lazy eye, an eye that actually does not function properly, and the other eye can mask that, and so you never know as a parent that they're not seeing with two eyes, they're only using one. So that's a very big piece of the puzzle. But you actually need to expound on that when they come to their comprehensive eye exam. And we check and see what's wrong with an eye that's not working properly. Or do they actually have some hidden vision issues with their eyes focusing and teaming together? How's their color vision? Do they have depth perception? All the things that are important as they continue to mature in those school years.
And those things would not be found on that acuity test?
No, definitely not.
So what are some of the tests that you might perform?
So when children come in to see me, we do several things. Initially, we do an acuity check as well. And even if they're not very verbal, we have amazing ways to check them, not just, you know, A, B, C. We can do numbers and tumbling letters and all kinds of fun things. Pictures,
and all
absolutely.
sorts of things.
And so we get lots of good feedback from the kids. We also check things like their eye pressure. We're looking for glaucoma in your children. We're looking for color vision issues. A lot of boys tend to have decreased color vision, and unfortunately that's a genetic link. We can't do much about that, but we can at least let them know that so they can learn how to live their life that way. We're looking for depth perception issues. Are they going to be ready for sports when sports come around? Can they throw a ball? Can they catch a ball? Things like that.
Because it all, again, affects so many other parts of their lives.
Absolutely.
Now, what would be some things I should do to prepare my child for visiting the eye doctor if they're a little bit squeamish?
I think the less said, the better, believe it or not. I think, unfortunately, if you tell them too much, they are more fearful of what's to come. We train our technicians how to work best with children and kind of laugh everything off. And, you know, the puff of air is a great way to clean the eye, and we're just going to clean your eye really quickly, and then we'll be ready to do all the other tests. And, you know, we try to do minimal invasive things with the kids. The most we can do with them, the better, but some kids are just not quite ready. So the first eye exam is a good building spot for us to decide, how well is this child going to respond to me? Am I going to get all the accurate answers I need, or do I need to do things on my own and just let them kind of enjoy the ride?
Okay, and if that first visit doesn't go so well, you can always plan to come back pretty quickly again.
You know, and you know your children, you know when you bring them in. But the one thing that is most important is not to give them fear of drops inside the eyes or the puff of air test. Those are the two that I think everybody hates the most, and so kids tend to be fearful of that as well. And the less they know in that on the front end, the better.
Okay, good advice. Thank you so much, Dr. Steele. And you can get in touch with Dr. Mandy Steele or one of the other doctors of Eye Care Associates at this website, eyecareassociatesnc.com.